thoughtful ideas and suggestions for guests and topics.
Great events, programs, and student activities.
All the countries are listening.
Welcome to this week's segment of Dialogue Houston. I'm your host, Lawrence Payne. To our regular viewing audience, welcome. To those joining us perhaps for the first time here for HCC's TV Dialogue Houston, we can be found now every Tuesday and Thursday at 6 a.m. and again at 6 p.m., Saturday afternoons at 3 p.m. And as always, let me thank you very much for your wonderful calls, emails, and text messages concerning previous shows we've aired here on HCC TV Dialogue Houston. For after all, this is your community affairs, public affairs show, proudly now in its 25th year, celebrating our 25th anniversary. I'm particularly interested in your wonderful calls and emails for upcoming segments for guests and topics and subjects to be covered, because we really want this anniversary year to be special, looking at all aspects of Houston as we go forward, because our community is just changing and growing so rapidly. The challenges also are coming with those growth and changes. So we want to make sure we have a chance to showcase those and dialogue with the people and leaders in this community who make things happen around those issues. We have a great show planned for you today. We're going to look at an aspect here at HCC through the Coleman College, which is really one of those fascinating kind of things we do here at HCC, among many things. But this one I think you will find particularly interesting. Sarah Prial is our wonderful guest this week. She is the Clinical Simulation Lab Technician. Got to say it right, it's a long thing. Clinical Simulation Lab Technician at Coleman College. It is an interdisciplinary program that she covers. She serves all program areas in the system. It's a system-wide thing. But wait till you hear her talk about what they do over there. Welcome, Sarah.
Thank you for having me.
So great to have you. This is one of those areas we get to feature within the college system that is really fascinating.
Very unique.
It is unique. So tell us about, that long title doesn't really do it justice, and so tell us exactly what this is and what we do.
Oh, well, what we do there is we take all the health science programs, including nursing and allied health, such as radiology and sonography and medical assisting and all the other ones, because there's about 20 of them.
Really?
Yeah,
that's
there's
another
about
thing we don't
20
realize.
programs.
Right.
And then some, because they're actually adding more.
Right.
But so what we do is they all practice in their labs, their individual skills, and they learn their theory and what they need to do what they're doing. And then they come see me up at the Simulation Center lab, and that's where I bring it all together for them. That's where they'll learn together, they'll intertwine together so that they're practicing together just like they would in a real hospital environment. Mm-hmm. And then they get to make their mistakes, which is what we actually encourage, because we want to help them grow.
How you learn and grow, yes.
Yep. We want to help them grow those good habits and take away the bad. And so they learn so much before they leave and graduate from HCC, and then they're better prepared for their actual career life on the outside.
And the stimulator, the actual machine, if you can say one parts of the machine, parts almost human, really gives them a chance with that hands-on practical kind of experience, practical experience that is really about as lifelike as you can get, lifelike as you can get. Is that correct?
Yes, they have patient monitors. Most of them have about every single pulse that we have. Some of them give birth and will hemorrhage. Others, you can bleed them from different wounds. They can go to the bathroom on command. We have pediatric simulators, OB simulators, trauma simulators. So you can do CPR and basically do resuscitation on a patient. They can also do crikes, where they actually slit here and they put in a tube to bypass the blockage in the throat. It's basically the sky's the limit with what you can do, and we have all real equipment that they use along with it.
So not only whatever would come through like a normal emergency room, also what would come through surgical units, all of it.
Yep.
We've come a long way from just practicing on cadavers, have we not?
Very.
So in the stimulator situation, it allows, I imagine, besides the body stimulator,
Right.
you have also this wonderful, I've seen it, it's like a war room technical thing. I mean, it is fascinating because you can move everything around.
Yes. So that's our body interact table. It's our clinical reasoning table.
Clinical reasoning table,
Yep,
I like it.
we love giving our new students that have just come in a chance to be able to really practice on that. Because the room's set up with the flow meters, the regulators, the patient monitor, where the oxygen goes, all of the physical aspects of a room get intimidating.
Yes.
Especially if you're just learning what you're doing. And so this table allows them to virtually touch, putting on the leads and the blood pressure and stuff. So they really hone in on their clinical thought process versus the physical aspect of a room. And then we also used it in tandem with anybody who's doing just simulations. I match up as close to as I possibly can a case that replicates what they're doing in the simulation with the mannequin. And that way they're getting to be able to reinforce what they did there. They can reinforce it there, or they can kind of practice before they go to simulation.
Right, and it's really that critical thinking skill you want to home in on.
Yes.
And,
yeah, it
and
really
quickly.
beefs up
You
the
gotta,
brain.
you gotta make the connections quickly.
Yes. Well, you're timed. So on the table, you have a minimum of 5 minutes to do the scenario, or a maximum of 30 minutes. So if the 30 minutes goes by and they haven't done everything, the simulation just ends, and then it'll show them where they basically left off at and what was still happening. Or the patient can go into cardiac arrest before the time comes up, and then they still get to look to see what they should have been doing and what they could have done differently.
What's the rate of people who get into programs who really get excited to want to do it? They think they want to do it, that they're looking forward to this being a career, but when they actually start doing it and realizing sometimes the awesome responsibility and accountability that goes with them making a mistake or not making a mistake. I've had one young lady in, not necessarily our program here, but another program at another community college that dropped out because she realized that she couldn't deal with the pressure of the possibility of making a mistake, because this is a human life.
Right. Well, most of the students that I deal with, when they do have, I call it career cold feet, because it kind of is.
That's a good phrase for it, right.
Most of them, you just kind of talk to them and find out what it is that's really, what their block is, what they're struggling the most with. And having faculty involvement, of course, is key as well, because they get to shine a light onto, just because you're stressed right now with maybe, doing ultrasound on a med-surg patient, or just because you're stressed with, post-op only, they get to go past that, and we show them that there's more than just that. I haven't really experienced any students that if they leave one program, they don't leave HCC totally. They just go into another health science program. That maybe is more up what they were going after, and they didn't realize that, okay, well, maybe I shouldn't really have done this. But most of our students, they love what they're doing. They want to do it, and they come in with high expectations of themselves, or they come in wanting like the good life. Like some with ultrasound, like to come in, they think they just get to ultrasound babies all day. But then they learn that they don't, but then they also realize that what they're doing is even bigger and better than what they thought. And so by the time that they graduate, they're excited. They're running for the door to get out and actually start doing what they want to do.
Is there a minimum requirement or prerequisites to get into the program, or can you just kind of transfer?
For each program that I deal with, there are different requirements. Yeah, since I deal with the 20 plus, everybody's got their own, but they can always just go to HCC Coleman and talk to one of the student services for the program that they want to go underneath, and they will help them out 100%.
And the programs run year round?
Yes.
So with people's work schedules compatible, they can come learn the skills?
We haven't had too many problems with any of the students. Most of our students work, and they go to clinical, and then they come to class. And
it makes it work. We try to make it work here. So in the question, I guess, because we're in the Texas Medical Center, because in Houston, I imagine as quick as you can train them and get their skill sets and certificates and graduation, there's a job waiting.
Yes, for most there is. It also depends on if they're planning on staying in Houston after they're done with their graduation. But I've already known of some most recent graduates from from probably May. Some of them are already working at Memorial Hermann and Methodist and Texas Children. So I mean, as long as they've got the motivation to go out and try and secure that job and go to the interviews and start looking about 6 months prior to graduation, most of them are going to find exactly what they're looking for.
I'm sure the programs are staggered as to the length of, how long does it take usually for the programs? They're all different, I'm sure.
Yeah, if they're a certification, they take anywhere from, I think, around 6 months or so to a year. It all just
Right.
really depends on the program. Most certifications are probably going to be about a year.
Okay.
And then any associate degree programs will be 2 years.
As we look kind of down the road a little bit, this growing technology that allows us to do all these wonderful things, that's changing and growing every day. You were mentioning before we started taping in the green room, all the things that this body can do.
Right.
Not quite walking and talking yet, but that's the next, I'm sure that's the next phase.
Yes, there is a simulator that is already developed that will move its limbs. I don't know if it will necessarily actually like get up and start walking
All right.
around, but they do have one that's already developed like that. It's still in prototype phase and everything. But the purpose of the simulators, yes, we would all like them to mimic exactly what a human would mimic, but the same, to replace the aspect of
Right.
you could possibly hurt that person. But in reality, all the bells and whistles are great, but it also hinders the learning process. So with like the simulators that we have, just because they don't move their arms and they don't move their legs when you need to, or like when they're doing the reflex, they don't kick up or anything.
Right, right.
It's one of those things that you don't really need that because
Okay.
you really need them concentrating on everything that's happening,
you
not
want them to focus
necessarily.
on it,
Yeah,
right.
you really want them to hone in on what the problem is and really get down to their skills and putting it all together.
We're going to take a small pause and break, and we can come back with Sarah. We've learned so much in just these first few minutes. It really is a fascinating area. And we want you to come and visit and kick the tires, so to speak, not literally. Check out the equipment. They'll do demonstrations for you of the stimulators, et cetera, because this is such a fascinating area and a growing area. So we're going to come back with Sarah after the break, and we're going to learn more about this wonderful process. Please stay tuned, and we'll be right back.
Julie was always a voracious reader. She'd carry 2 novels on an airplane because she'd read one on a 3-4 hour ride. And at some point, I began to notice that she would read a page and couldn't remember what she had just read, and she'd have to go back and read it again.
I don't remember much these days after I read, but less does for me, and I love it.
HCC. So many degrees, so little tuition. Register today at hccs.edu/now.
When the field of medicine and technology kind of merge, you end up with this wonderful position of the person we've been talking with here at HCC, none other than Sarah Prial, who is the clinical stimulation lab technician, who kind of really brings all this together. She's a software engineer, really, who has learned all the medical terminology and techniques that you have to do to integrate the two together in the 10+ years she's been doing this. And I think it's very important because what you see is that in her case, a learning curve in learning the parts of the medical piece you needed to pick up, but now you're able to match the two together and work the two together in a way that, as we were saying before the break, gives the student who's trying to grasp all this stuff, the technical aspect of it as well as the cognitive and the parts of it, right, in real time, and be able to make those quick decisions that you have to make,
Right.
and be confident in your decision-making process.
Exactly. And me being technological based,
Right.
learning the healthcare, learning the acronyms, the medicine, the different types of procedures and basically symptoms and problems that a person can face has helped me to bring the realism tenfold to these students. So I am now able to, over the course of my
Right.
long-standing career so far, I'm able to really make a trauma scenario look,
Invaluable
feel,
long-standing career, let me just put that, I think.
I'm able to bring that realism that they would see in a hospital and bring it where by the time that they walk in, they forget they're even doing a simulation.
Right.
They actually feel it's real and they act in the right way. So it really shows them what they're about to deal with when they graduate.
So let's turn for a moment and apply this to the patient.
Okay.
If a patient was about to have a procedure and is fearful, because I've had even a family member who is just so fearful of the procedure, not that the outcome will not be well, perhaps, more of just the procedure itself.
Right.
You could almost show them, walk them through the diagram of what's going to happen.
Right.
With some comfort level of this is actually what's going to happen, how it's going to go, et cetera, and take some of that mystery and demystifying out of the process. I could see this also applying at some point to patients.
Yes.
Helping patients understand what they're about to go through, how it really happens and works, and make that much more of a comfortable thing to have to enter into. You have to do it,
Right.
but at least you have more, perhaps a better feeling going into it.
Yes. And then simulation centers across the world
Right.
actually do that. So one of the most famous hospitals to bring out about
Right.
it is CHOP, Philadelphia Children's Hospital.
Ah, okay.
So they don't have an actual center like HCC does,
Right.
where they do all of their training and everything. And most hospitals don't. A lot of them are based within the patient room. So
Right.
CHOP is famous for doing in situ, which is where they take the simulator to the patient's room and they run through everything on the simulator with the patient and the family members
Right.
sitting right
Oh,
there so they
wow.
can see what's going to happen.
Yeah.
They run through the different types of outcomes. They run through basically what the parents are going to look for. And a lot of the hospitals around here, they also do that as well, even with adult patients, so that it calms you down.
Yes,
it makes
it
you feel a little
does.
bit more, because we all know medicine is ever changing and nobody really knows everything about medicine. And so we always start hearing, well, this is what happened to this person. So then we start to doubt what our doctors are telling
Yep.
us just because we're human,
Yep.
right? And so doing the in situ allows you to be able to show them, well, this is what's going to happen to you. This is what we're going to do.
Right.
And it makes you feel better because now you're seeing it. You
Right.
can YouTube your procedures all day, but it's not the
No,
same physically
not the
watching
same, right.
this stuff happen right next to you.
And the doctor who really is trying to take the time with the patient and be compassionate and have empathy, even when they explain it so quickly, and
Right.
you don't, because you're really almost, first of all, you're just still in shock that they told you have to have it,
Yeah.
have the procedure, so you really don't listen.
Right.
But I think that would be very important going forward. And because medicine, as you said, is not an exact science.
Nope.
I had a person who was a professor at a medical school tell me years ago, that's why we call it the practice of medicine.
Right.
We can eliminate what it is not, and that's part of our process, to eliminate what is not. I can tell you what it's not. I can't tell you what it is yet,
Right.
but I can tell you this long list of stuff that is not because we run all those tests.
Yes.
And so I think that's important to know that from the patient side of it, I think more needs to start doing that
Right.
process. So let's go forward a little bit also. So we have this program, you're system-wide, all interdisciplinary programs. Obviously, it's an area that's only going to grow and grow going forward, not only in this campus, but the need is here even in this city, let alone the rest of the. So I think that probably in the growth area of the college, this is one of those that obviously is just going to go shoot off the market in the next few years.
Yes. Oh yes, simulation is going to get very big. With us being in the heart, located in the heart of the Texas
Yep.
Medical Center,
Right.
Collaborations with the area hospitals are going to be huge. In addition, being able to show and do things with our students, just alone with our students, is going to propel HCC so high because we're giving them the latest and the greatest in technology, but we're preparing them for the, I always say, and I tell my the students that come through
Right.
the simulation center, we prepare for the worst, we plan for the worst, but we hope for the best.
Right.
So I actually run the simulation center as if they're going to a hospital with no money, or they're going to one that's maybe underserved.
right.
So that way they're not getting used to just being in a very nice, well-manned, well-to-do hospital like in the Texas Medical
Right.
Center, but they may get somewhere out rural.
Yeah, right.
And that hospital serves underserved people, and so they don't have a whole lot of supplies. So they have to kind of think outside of the box.
Mm-hmm.
So I'm a real big advocate for thinking outside of the box with all of our programs, only because we rely so heavily on technology, and we rely so heavily on everybody having what we need, and we
Right.
don't realize that we also live right next to the Gulf of Mexico.
Exactly, right.
So it's never a guarantee that we're going to have everything or that everything's going to be here when we need it.
Mm-hmm. What role do you see more and more robotics playing in surgery? Because I know now there's some surgical procedures that are really done basically through robotics, which has really cut down on the patient recovery, patients' incisions, patients, because you used to have to cut open
Right.
everybody for everything. Now you don't have to do that.
Right. The Da Vinci robotic machine is out and rampant all around the world, and that's one of the biggest robotic surgical machines out there that doctors just love and eat up every day because I mean it's like
They gave
a
it a good
precision
name, didn't they?
instant.
Da
Da
Vinci.
Vinci, yes.
Okay.
I see it playing a huge part only because of the fact that we're minimizing the damage that we're doing to the person.
Right.
We're minimizing their downtime. Their recovery time is going to be increased, which means that they're able to get back on their feet, get out there. So not only is simulation and technology going to make an impact just in healthcare, but it's also going to eventually ripple through to economics and labor, and it's just going to end up expanding all the way across where we can maybe finally get back to a good state where we all feel comfortable and that we don't have to worry.
And the cost factors are something we can deal with because
Yeah.
it's getting out of hand basically right now.
Right.
So if we, again, look at the future, because I'm trying to always be future orientated because I think that's really where it is. We're in the perfect place by being in the medical center and with HCC partnering together and having those conversations about what do the end user really need that we can prepare those students for.
Right.
And keep that pipeline, because it really is about the pipeline, keeping the bench both broad and deep in the pipeline to have those students available to be employed, not only here in Houston, but across the nation, as you said. And I guess that the investment, the financial investment that has to be done to keep up with this is really probably one of the biggest challenges, because this equipment's not cheap.
No, it's definitely not cheap at all. But being able to maintain the equipment and really focusing on what the equipment needs and not, overly abusing it or doing stuff that you shouldn't be doing to it, the longevity of the equipment actually goes a lot further than most people think.
Right.
And you can get more out of it, especially when you have somebody that can understand the inside mechanical
Right.
and technology base that's in it. But then at the same exact time, a lot of these area hospitals, and when they see a need and they say, we'd love to see the students really start doing this because we've had to add this, or, we really want to see them do this, or they start finding things that they need training on. You'd be surprised how many people, the collaboration is going to kind of eat that up, where it's not going to be so much of a big stake for us
Right,
to do,
right.
because it will be a stake everybody gets
Right,
into.
everybody's be part of it in a collaborative partnership.
Right.
What have we not touched on that you want to make sure we mention here before we have to run out of time here very shortly?
Well, simulation is never going to, of course, take the place of dealing with your patient hands-on, face-to-face, so it'll never take place of their clinical environments. Simulation was built to help them take the theory and put it into practical use with their skills that they're taught. And so it's one of those things of it's very important that they do simulation, because they're always scared and terrified when they walk out and get on that clinical site, and then they're like, oh my goodness, I have to do what now? And so it's very important that they get to experience that beforehand without being judged by patients and family members, because I mean, we all do it. We're always making sure that our families are getting the best care, and I think being able to prepare them for things like that before they leave is just, it's necessary, it's needed. But the biggest thing that we're doing at the Coleman campus right now that most places aren't doing anywhere that I've really heard of is we're a community college doing interprofessional education. Most places, they don't really touch base on that until you get to the real world environment, until you get to where you're actually being paid to work. But we decided, well, HCC decided that it was really important that they learn how to communicate with each other, because those stereotypes of this role's here and I'm down here, we're trying to just eliminate all those barriers.
That's not good for the patient or for the consultation team.
And the healthcare, if anybody's really noticed, you have to be able to work as a team. And if you can't be the team, then that patient's never going to get the best care. And then not only that, but we're teaching them that they have to include the patient with the team and the care. So they're learning all of these new things that are just vital for a patient to really get better.
And I think that the team aspect is so important.
It is.
They've heard me say this many times in dialogue, because I'm a stroke survivor. So the team that I had after my stroke was really a marvelous group of doctors and nurses. And the personal health challenges I'm going through now, I have a team, and the team really makes the difference. And they communicate with each other. They know what each other's doing. They know what their the procedures that they're asking to do, et cetera. And it's important to have someone keep track of all that. In the case of the patient you mentioned earlier who doesn't have a patient advocate or doesn't have someone to speak up for them, so much falls through the crack. On patient care, even in the best of facilities. It's a constant thing that people really have to be very aware of all the time.
Right, and we're all human, so
the
we
human
can't
factor
memorize
is always
things.
there.
We don't memorize things. We don't know everything. We're just human. So we need other people to have our backs at the same time as to ensure that we don't make mistakes. I know a lot of people, they feel that if I tell you, oh, well, I think we should do this, I'm automatically trying to undermine you, and I'm not. I'm just trying to protect you and everybody that's doing what we're doing.
We're out of time, Sarah.
Thank you so much.
I want to thank you so much. I can say that obviously you can tell we're in good hands with Sarah in more ways than one, because I think it's so important that she really focused on the integration of the technology, the being a software engineer with the medical, and how those two work well together. Someone who's taken the time to really integrate with those two pieces of knowledge, I think is very important. So thank you again, Sarah,
for all
you do here on the campus. All right, we're going to get out of here. We'll be featuring other aspects, not only of HCC, but also the community that we love so much called Houston, as we go forward to figure out how to together make this place a better, caring, more empathetic place in serving all human beings' needs. So watch us as we go forward in the weeks to come. Until then, as always, thank you for joining us, and peace, power, and love.